you're a nursing student that wants more practice with Nclex style questions, you're in the right place. My name is Amber, aka Nurse Glamber, and I'm a registered nurse, and I help nursing students bridge the gap between nursing school and the board. So tonight, it's Workout Wednesday. We're going to dive in and do an Nclex style question together. Let's get started. The nurse is caring for a client that has 34 weeks gestation receiving an IV infusion of magnesium sulfate for severe eclampsia. The nurse notices that the client has become drowsy, a respiratory rate of 9 a minute, and a urine output of 30 mils in the last hour. Which of the following actions are most appropriate for the nurse to take? A, immediately notify the HCP, slow the infusion rate, and administer calcium gluconate. B, stop the infusion, administer oxygen, and prepare the client for catheterization. C, slow the infusion, notify the HCP, and administer oxygen. Or option D, stop the infusion, administer calcium gluconate, and notify the HCP. So let's go through each of these options together. I like to do a side-by-side comparison and think about what you are going to want to do first. What's most appropriate? What's going to keep our client safe? Remember, meg sulfate is a high alert medication, which means there are some things that we need to be concerned about when infusing this medication to our patients, okay? So if I had to choose between A, immediately notify the HCP, slow the infusion rate, administer calcium gluconate, or stopping the infusion, administer the oxygen, and prepare the client for catheterization, I'm going to go with option A, right? Because if I'm going to break this down, I want to reduce, if you will, what is happening to this patient and give them something to help them, because the indications that we are seeing in this question indicate that this patient is having signs and symptoms of meg sulfate toxicity. Okay, so option B, stopping the infusion and administering oxygen and preparing the client for catheterization. That's not really solving our problem. So let's get rid of option B. We're going to keep option A for now. Let's compare it to option C. So option C is slow the infusion, notify the HCP, and administer oxygen. Well, none of those things are going to potentially help us reverse what is happening to this patient. So I'm going to eliminate option C right out of the gate. That's not helpful for what's happening to our patient. Let's compare option A to option D. Stop the infusion, administer calcium gluconate, and notify the HCP. So let's talk about this. D is actually the correct answer, but let's talk about why. Anytime that we have a high alert medication, right, especially with magnesium sulfate, we always want to stop the offending agent, number one. That is number one. That's what makes this question correct over option A, because we don't want to just slow the infusion rate, and we don't want to necessarily notify the HCP first. We want to keep our patients safe. We want to save their life, because here's the reality of the situation. With meg sulfate, these patients have a potential to go into respiratory failure and cardiac arrest. This is life-threatening. So we want to stop the infusion, administer calcium gluconate, which is the antidote, and then notify the HCP, okay? And then we would implement any other interventions at that point that would potentially, help our client. But from a safety standpoint, you need to stop the offending agent, administer the antidote, and notify the HCP. If you found this helpful, please make sure that you're following this page for all Nclex tips, tricks, questions, and content. Save this video for later for your reference, and tag one of your nurse besties that would benefit from this video.